Welcome to the different phases of trauma. And I am glad to see you here today. And I am looking forward to this experience. I decided to do this offering because I feel like I want to be able to make as much information available to the public as possible, particularly for people that look like me. And a lot of times people utilize or say, I have a trauma response, I'm being triggered, and have all these language that is being used, but people don't really know what it means. And since I am a certified trauma therapist, I want people to be able to have as close to as much knowledge as possible as it relates to what trauma can look like, what trauma can morph itself into, and to be able to have some tools that they can practice utilizing when they're feeling with heightened emotions, or when they're feeling highly stressed, when their body is feeling dysregulated, when they're having difficulties finding a way how to ground themselves. We're going to be using some of the EMDR resourcing techniques that can allow you to do that at a much faster pace. Okay. If you have any questions, please feel free to ask. Okay. So we're going to start off with, what is trauma? Right? Trauma is when your brain and when you experience a highly impactful, stressful, frightening event, causing you to not be able to respond in a natural manner. So this is when your sympathetic system, which is your fight or flight, kicks in. And when that happens, your body is not able to fully respond in the way that it needs to. Your brain is not able to store the memory of what happens or what you experienced in a sequence. So it gets disrupted and it gets fragmented in your brain. So then you can experience, I remember certain aspects of it. I remember the smell when that happened. I remember, that how my skin felt. I remember parts of how my body felt, but it's not a complete memory that takes place. So it doesn't allow your brain to store it in a healthy place. This is what causes people to have flashbacks, to have nightmares, to not be able to step into some places or have certain sense, because their brain takes them right back to what happened then, right? So there's a mixture that takes place between the present and the past. It gets mixed in where your body does not know how to respond, separate from, I got to protect myself, right? So one of the key things is it can happen during any stage of life. From the moment you are in your birthing parent's womb to your adult age, but there's different types of trauma that take place based on the stages of life that we're in. So it can happen when your parent is giving birth and something happened during the birthing process. It can happen when you are at home and something that you witnessed. It can, as a child during your developmental years. It can happen being bullied. It can happen with witnessing your parents going through a hard experience, witnessing violence, witnessing being in communities that are underserved. It can happen when you are in the military, active duty, or during training. It can happen in the workplace. It can happen when you are experiencing racism in the workplace, right? It can happen while you're in prison. It can happen with police officers. Social interactions that go wrong and cause your body to feel like, I need to escape this, and I'm not able to escape it. So I feel trapped and get stuck in that. It happens in our relationships, right? So one key thing that you want to remember when it comes to trauma is it is impactful. Your brain is not able to process it in a healthy manner because it is not able to process it in like a linear and full place. The way it processes is, I saw this, then I saw this, and I smelled this, and now it's all over, and your body has to find a way how to respond to the situation, which Its response is reaction and right. The key things that you want to also know is not everybody responds to trauma in the same way, right? And we're going to go into like the different types of trauma. We go from developmental traumas to complex trauma, to vicarious trauma, to acute trauma, medical trauma, birthing trauma. So when you hear people talk about developmental trauma, that is things that happen in your early childhood. Those traumatic experiences that as a child, your brain is not really able to process. So it does not get stored properly. And then it causes you to create ways to adapt. It impacts how the child thinks, or how they retain information, how their emotional abilities, how emotionally flexible are they. It impacts their behavior at school, ability to engage and socialize, to respond to real life or stressful situations in a healthy manner. That happens during our developmental years, which can evolve into adulthood, right? We get to separate that when we are trauma therapists. We get to pay attention to what are some of the symptoms that show up, like, oh, this is developmental versus this happened to this person as an adult. When we go into complex trauma, it's a series of traumatic events that takes place for extended periods of time. Let's say we go with basic example. Let's say somebody experiences trauma in school. I'm being bullied on a daily basis. I'm not being protected by my parents. I'm not being protected by my teachers. I'm not being protected by the people that are supposed to protect me. I go into, that can be happening in elementary, middle school, high school, and college. The people that you meet kind of begin to behave in a similar way because that may be what we know, and we're trying to overcompensate, then it can go into the workplace, right? So those are things that are consistently happening to us where our body is not really able to fully respond, or our brain is not able to fully respond in a healthy, natural way. Then we go into vicarious trauma. So vicarious trauma is, for example, as a therapist, we get to hear details about our clients' traumatic experiences. And the details can be very gruesome, right? As we're teaching them how to cope. So I can be hearing somebody's details, and then my body begins to respond in the manner in which the client's body was responding. That can be vicarious. For the person that does not do this type of work, it can be what you watch on TV. It can be what you witness in your neighborhoods. It can be what you witness in social media, the traumatic things that people post. It's coming in through here. I always tell people, you want to discriminate as to what you're taking in. You want to be able to be very intentional about what information you're taking in, because you are going to be impacted by it and you cannot undo it, right? It's already done. So it is exposure to other people's experiences and to their stories and to what they've witnessed based on how they shared it with you. Then we go into acute trauma. Acute trauma is one traumatic incident, car crash, or car accident, a bad fall. It can be something horrible that happened in a hospital setting. It can be a natural disaster that people experience acute trauma. So that is a one traumatic incident that took place that your brain was not able to respond in a manner that it needed to in order to feel or respond healthily. Then we go into that. Then we're going into like medical traumas. And the medical trauma is of course a highly stress event. It can happen within the medical system. It includes surgeries that have gone wrong. It includes the way you've been treated when you're even entered to the hospital, being misdiagnosed or being diagnosed with something and not receiving the proper treatment. It can be not receiving the care that you need if you're experiencing chronic pain. Some people have had surgeries and woken up in the middle of the surgery because they have not had enough anesthesia, but they can't hear you because the other part of you is unable to speak, to be verbal during that time, but your body is somehow awake. So that has happened to people. Those are part of clinical traumas. Then we come into birthing traumas, right? It happens to the birthing parent where highly stressed is a disturbing experience. You may not have received the epidural on time. You may have not been expecting how your body was going to respond, or your body's not really able to respond in the way it needed to, in the natural way, the way you may have been treated by the medical providers. The expectation that once you had the baby, being able to breastfeed if that, or not being able to sleep, not getting the support that you need. All these things can create traumas in our body, and it directly impacts how we engage and how we are able to manage difficult, challenging situations in our day-to-day lives. If you have any questions, put them in the chat, and then you can interrupt if you need more information, okay? Now we're going to be getting into, why does trauma have different faces? Why does it present so different for people? It depends on the way that we adapt to it, right? So I always say trauma is flexible, it is tricky, and morphs into other symptoms that can feel like other diagnoses, right? And the response that we can have, it can be depression, anxiety, ADHD, chronic pain, personality disorders, phobias, criminal activities, violent responses and aggression, addiction, domestic violence situations. So depression, it makes sense. There's a reason why I feel sad on a regular basis, and I don't really have a reason as to why I should feel sad. It doesn't go away. You're assessed when did that start? I remember when I was a child, blah, 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 blah. And okay, what happened during that time frame? Right? A lack of motivation, having difficulties focusing and concentrating. Because when trauma happens, your brain is not really able to store it properly, which directly impacts your central nervous system, right? And it also impacts your ability to understand, it impacts your cognition, right? Then anxiety. I've always felt anxiety. Can you notice what's caused it? Like, I don't know. I just feel like my body is always in this, like sweaty palms, increased heart rate, my body constantly feeling tense. Is there anything, does it run in your family? Actually, it doesn't. Is it learned behavior? No, it is not learned behavior, because I didn't witness that in my home. Having difficulties being able to sleep, right? I'm having difficulties being able to focus. Where is this coming from? We really don't know. Let us explore where it started, right? So when we're looking at things from a trauma lens, it allows us to be able to see what are the other things, what are the other factors that were taking place that caused this to happen. Now, we have ADHD, right? A lot of people have been recently getting diagnosed with ADHD. A lot of children get diagnosed with ADHD. A lot of times, those can be misdiagnoses, particularly if they're not taking into consideration the environment. And the environment really meaning social environment, home environment, school environment. I can't focus. I have difficulties being able to concentrate. I start one thing and start with the next one and start with the next one. I really can't understand what is being said. I can't stay still. My body is constantly in this state, right? Some of those symptoms also do this into the trauma, right? Because of it. Then we have chronic pain. I'm not sure if some of you have ever heard of fibromyalgia, which is people experience full body aches and pains and they have no idea as to why it's happening. So when doctors don't know what is causing this, sometimes people get diagnosed with fibromyalgia. A lot of times when clients come, we get to ask, when did that pain start? I've never had a car accident. I've never had any injuries. It just started in my back and then it extended into the parts of my body. I get headaches, I get this, and no matter what happens, I continue to feel this. Then we assess it from, when did this first start? It started in my 20s, right? It may have started during transitional times, transitional stages of their life. Or it started when I was in this situation and I got, felt it in my back. It was a very highly stressed situation. And now this is where I'm at. Then we go into personality disorders. What many people know about is the narcissistic and the borderline personality disorders, but we have a whole many more like avoidant personality disorders, obsessive personality disorders, and addictions and stuff like that. That becomes your body is trying to protect itself from what happened, right? Remember, if our brain is going back and forth between the present and it's mixing the present with the past, and your body is responding as if it's still here, although we're right here in the present, then I need to find a way how to protect myself. It can happen with, as children, usually gets developed during developmental stages, but we get to see the difference during those adolescent years and young adulthood, because you're paying more attention to like, why is this person behaving this way? And that was probably the way they needed to adapt to the environment in which they were in growing up, right? It could have been a household where there was violence. It could have been a household where there was addiction. It could have been a household where there was neglect. So there is a reason why people have personality disorders. It doesn't just come out of the blue. It's a response to something that's happened to them in their life, and their brain was not really able to process it. We go into phobias, right? We go into criminal activities. If we pay attention to the majority of the people in our prison system and our jail system, there's a lot of mental illness, right? Along with traumatic events that take place in the prison, but traumatic events that have taken place in their neighborhoods and the community that's been witnessed. How do you respond? I need to protect myself. How do I protect myself? With, right, criminal activities, aggressiveness, oppositional, because that is the only thing that I have right now that can protect me from the outside. Then we go into addiction. And when we bring in addiction, it's not just alcoholism, it's not just pills, it's not just other hard drugs, it is shopping, it is eating, it is anything that we're doing that in repetition, that repetition that brings you a sense of relief. Since I am feeling relief when I do this, my brain begins to distort it in a manner that is what I need to continue to do. People that fall into addictions, it's not because they want to. It is a way of numbing and protecting themselves from what is happening now, right? This is happening now. Remember, it's mixed in with the past. But since I'm experiencing this now, I'm going to respond for it now. But in reality, I am responding to what happened to me then, that I am not capable of managing those symptoms from then, now. And if particularly if it happened during developmental years, the person did not get the ability to develop and evolve cognitively to respond to stressful situations or day-to-day life challenges. So they're going to respond with this. I need to numb it. I need to avoid it. Whichever way I can do it, I'm going to do it. Then as we continue to go into the different phases, now we're going into, how does drama show up in your body? Trauma shows up through chronic conditions, hypertension, heart disease, cardiovascular issues, diabetes, chronic pain, insomnia, can be not sleeping or sleeping too much, over or under eating, skin conditions. We get a suppressed immune system, asthma, tension, feeling overwhelmed on a consistent basis, not being able to manage and handle stressful events. Those are all how your body can respond to it. Hypertension and diabetes is not genetic. It's not just genetic. It is, the majority of it is environmental and what we have experienced in this life, that's where it shows up, right? So when any of these symptoms are being experienced, I ask that you ask yourself and get curious with, what's been happening or what have I experienced in my life? Because there is evidence that when people experience traumas, it does show up in chronic conditions as adults. Now, another thing that happens when we are experiencing these symptoms can be, how do I allow myself to experience it, learn how to cope with it, and then respond to the situation? That's where we're getting into the avoidant part of this. Okay. Now, what's my time? Okay. Yeah. So how and when does trauma impact your life? So if what I shared already is not enough, we have more, right? So it impacts your ability to understand, to experience, and to cope with emotions and life in a healthy manner, right? So it impacts our relationships. It can be family relationships, romantic relationships, friendships, work relationships. It doesn't really allow us to be able to identify the people that would be supportive or the people that will be complementary to us. Because if we have been in spaces where from those developmental years, that the persons that we come in contact with have not really been able to show us a consistency there, then how can we be able to nurture any of these relationships? We begin to codependency, avoidant, a lot of our anxiety-driven relationships, being able to overcompensate in relationships and not really understanding why that's taking place. Let's dig a little deeper to find out, where did we witness that? How were we impacted by what we saw? Even if you were a single parent household, there was something that you witnessed that this is showing up at you experience as it relates to. It can be emotional neglect, it can be physical neglect, it can be abandonment, both emotional and physical and mentally, right? Then our motivation. I don't want to do anything. I don't feel driven to do anything. I'm not going to do anything, right? It can also show up as our creativity and curiosity. Since our brain is not really able to process those memories or those traumatic events that took place, it dysregulates our ability, our whole body, right? Then it also cognitively impacts our ability to be creative and be curious. So sometimes you're chatting with somebody, you're like, oh, let's be curious about it. What about this and what about that? And the person's not really able to even imagine, right? It takes away some of that imaginary work. It takes away some of that fantasy, because I need to know exactly what's going to happen and how it's going to happen. I need to be in control of every aspect of it in order for me to be able to feel safe. And even when that happens, my body's still doing this because I am still responding from that space, right? It impacts a person's learning abilities. I read that, but I really can't understand it. I'm having this and I'm continuing to have difficulties being able to store information, being able to share the information. It impacts our ability to trust ourselves and to trust others, right? Particularly if we have experienced developmental traumas or acute traumas where major incidents have taken place. Example, people who have experienced sexual abuse, domestic violence. I can't really trust those who were supposed to protect me. I can't, if their parents were neglectful or the caregiver was neglectful, that directly impacts our ability to be able to gain a way how to trust ourselves, which doesn't really allow us to trust other people or to trust the decisions that we make as to who we want to allow into our world, right? It turns into reckless behaviors as well. This is how it impacts us. Self-harming, addiction, not doing things that are reckless, jumping off cliffs, but jumping off cliffs where, we can do it for fun. This is different between doing it like, oh, there's rocks. We really don't know how deep this is, right? So seeking that sensation, it can impact parents, right? Your ability to parent. Inability to be able to be present for the kids. If there's loud noises in the home or screaming in the home, because that's what kids do, it can trigger the parent, like, I don't know why this is happening, but we respond in a screaming way as well. And that is your body trying, like, this needs to stop in order for me to be able to function, right? All of this impacts your ability to make decisions. If I am not able to trust myself, if I am not able to be curious, I can't really be creative, I am being impacted by my learning abilities, blah, 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 it's going to directly impact how I engage and the decisions that I make. So sometimes if you know somebody, like, for some reason they continue to make the same decision and they're still in the same place, they just don't get it. No, there's a loop taking place that doesn't allow them to be able to better understand it. Now we go into, how does trauma impact other people's lives? Domestic violence, aggression, addictions, choosing the wrong partners intimately, or choosing the wrong friends, inability to trust. So we can be with a partner that can show you everything that you need to see, that allows you to, I am worthy of you trusting me, I follow through, I am consistent. And there's a part you're like, nope, not really. I can't trust them because it can happen that one time, right? And that one time, if it happened, or if there's possibility of it happening, I'm not going to be able to be present in the relationship. Codependency, inability to communicate. If I communicate, if I share what I'm experiencing, this person is going to abandon me, so I'm going to keep it down, right? If I share what I am feeling, or that I am in disagreement with, or that I have to set a boundary, I may end up getting hurt, although they never shared, they've never shown any form of aggression. I'm not going to say anything, right? Because I'm not able to trust what is being experienced in the present, because I am still living from what happened in the past. What can trauma sound like? I can't trust anyone because everyone is out to get me. I'm not safe anywhere, even when I am alone. I am going to fall no matter how much I try, so I might as well, I'm just gonna give up. I am not good, so I will not do good, right? I am a bad person because blah, 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 blah. I cannot communicate because I will blah, 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 blah. I continue to make horrible decisions. I'm so stupid. No matter how much I try, I still end up in the same situation, or I still end up in the same relationship. I still end up having the same communication issues. I keep having this feeling of doom. I'm always afraid, and I don't understand why, and why is this fear so crippling to me. I need to have control of everything. So every single detail of how things will go wrong, I need to know, just in case. And then it goes on and on and on, right? So the impact that it has on us, it ricochets into everybody else that we connect with. But one thing is, we are able to try to find different ways how we can respond in a healthy manner. So now it's, how will your body try to protect you? I'm going to avoid this like the plague. I'm going to disassociate. And disassociation comes when, for example, let's say you're driving and then somehow you got home and you don't know how you got home, but you're home, you completely disassociated during that time frame, right? When people experience traumas, they fully protect themselves. So sometimes people get to see themselves outside of their bodies. And it's like, that is happening, I'm not there. And then once it's over, the person comes right back into their body. Their body experienced it, but their mind completely disassociated from it. Multiple relationships, right? Because of the fear as to what will happen if I am in this relationship, what the impact is going to be. Once again, addiction. I need to numb, numb, numb. I can't experience this because I do not know if I'm going to be able to handle it. That comes from a lens of, as an adult, I don't know if I'm going to be able to manage the emotions or the sensations that I'm going to experience. So I'm going to numb it, right? It can mean I never learned how to manage my emotions, how to respond to them in a healthy manner. Those were skills I didn't get to learn. So I adapted by avoiding. I adapted by, we call it creative adjustments, right? I found a creative way how to respond. And the creative way was to hide, to avoid, to dissociate, right? To keep busy all the time. So that way I don't have to deal with what's really happening in my body and what I am really thinking about.
Hey,
Codependent.
Nancy. I
Yes.
just wanted to bring your attention to the chat. We got a couple of takers here and some conversation.
Okay.
Um, you know, definitely resonating how trauma shows up in your body. Personally, I
Okay.
grind my teeth, definitely feel
Mm-hmm.
overwhelmed. We have some co-signing to the teeth grinding, also joint pain and insomnia, tension, headaches, nightmares, and shallow breathing. So I think most people have suffered some of this. Um, Creative adjustment definitely resonating because
Mm-hmm.
I'm the type of person who I'll just clock out of a conversation like, let me shut up
Mm-hmm.
because it's
Yes.
going to be a fight, you know?
Yes.
So thank you to everyone for sharing. So definitely continue to drop your comments. So uh, let's keep it going.
Yes. So then we get into self-harm. So not only do we have addictions, avoidance, obsessions, the multiple relationships, disassociating, but now we also have self-harm. In addition to, those are all forms of self-harm, but I'm talking about the self-harm. It can be cutting, right? Suicidal attempts. In order for me to feel something, I need a reason to feel so I can cut myself, and it gives me a reason to cry, or it gives me a reason to feel an emotion, right? It is not the person, they're just looking for attention. No, there's a reason why a person is doing this, right? Lack of sleep. I function better in 4 or 3 hours of sleep. That's a lie. We're human. Humans need to be able to get good rest in order for us to be able to think clearly during the day and function to our best ability. Our body feeling this type of tension. And us not really noticing, yeah, I always feel anxious. Yeah, this is just how I always this is my baseline. No, that is not anybody's baseline. This, when your body's doing this. That is in response. Your body is communicating something to you, and we need to listen in to see what is communicating. All right. And we need that time. Now we go into, how will I know if I have trauma? Since all these things are morphing into each other, all these diagnoses morph into one another, trauma can be anything. So first is you go see a trauma therapist or a psychiatrist, and they can assess you for it. You want to make sure that the person that is going to be assessing you has experience and has worked with people who experience and suffer from trauma. We have therapists that are certified in being trauma therapists, and you have therapists who are certified in different techniques, like, like I'm certified in eye movement desensitization and reprocessing, which is EMDR, and as a generic trauma therapist, right? So you want somebody that knows what they're looking for and knows what the other signs that do show up, and they're able to provide you with support with that. Medications will numb it. Medications will not resolve trauma. They can also just numb the symptoms of it. Pay attention to what you are experiencing and your patterns of behavior. Take a chance if you can and get curious with it. What would this feel like? Let me give myself some time. Let me just make a little bit of space to feel the discomfort, to see what's really happening, and give yourself the chance to be honest with yourself as to what comes up, not sugarcoating it for yourself, right? So if it's something that you don't like, I don't like this, and I don't like that I do this, as opposed to like, well, rationalizing it. We're not trying to do that. Let us be able to ask real questions. And this is some of the questions that you can ask. When was the last time I reacted this way? We're looking for patterns of behaviors, right? How far back does this behavior go? What was happening during that time in my life where I'm becoming aware of this behavior? Do I have similar feelings now to when I was doing that behavior then? Or do I have similar sensations to that? So I feel this flutter in my chest and in my throat. I get these aches and pains here whenever I'm feeling stressed or when I'm experiencing this with a particular person or when I'm engaging in this way. And when I think about it, I also used to experience that in high school. Well, let's go a little bit. Hold up. I used to experience this in middle school. And yeah, sometimes my throat aches and what else? And as you continue to go back, oh, I wasn't really able to communicate growing up in my home because if I did, I would get back in the face or I would get mushed or I would get shut down. So I'm gonna lock it in and I'm not gonna say anything, right? How does it feel now to do the behavior, right? Is that behavior aligned with who you are now and who you're working on being, or does it align with who you was then, right? Am I feeling scared about finding out where it's coming from? Does it still work for me? Is it aligned? Right? So these were the creative adjustments that I had. This is how I used to behave, and that's what used to work for me. These were the beliefs I had. The word keyword there is had, because it no longer works for me. And now I can't change it. Somehow I feel like I can't change it. So we explore that, right? And can I practice changing it? That's the key. Do I give myself permission to practice changing this behavior, right? What I need y'all to be able to pay attention to and give yourself permission to do is, I will seek support if I notice it's becoming more and more challenging for me to do this. If I cannot stop it, and if I continue to do the same behaviors and I know it's not working for me, but I'm continuing to do it, I don't have to do this alone. I can get support. And that's why mental health services are there. Or that's why we're also doing things like this to be able to find ways how we can cope with this. So we're going to start getting into some coping practicing, right? So we have how to cope with trauma symptoms. So safety is a big issue when a person experiences trauma because you didn't feel safe during that. Your body needed to protect itself. Hence why your brain stored it in such a disjointed way, right? So safety is a big thing. Practicing feeling safe within yourself is very, very important. Particularly if you're a person of color, this is a very big ask. But one thing you can't practice doing is practicing the feeling of safe enough within yourself. So body movement, yoga, organized dance, that helps, right? I take up this much space and I am still okay to do this, right? The yoga moves and all that stuff, that's very helpful. But what we're going to be practicing now is something that is known as the 4 elements. We use it in EMDR with clients, and something that is also, we also call calm and safe place, which is, we call it calm enough space. And the 4 elements were, the 2 was by Ellen Shapiro. And the calm space is what we do in EMDR before we're going to start doing like sessions with clients. So what I want you to do is, first, I want you to, before I move on, Fran, do we have any questions or anything?
Yes, we do.
Okay.
Do you have recommendations for trauma certification programs?
You can go to the EMDRIA website And there it will tell
The
you
Andrea website?
EMDRIA, EMDRIA.org or .gov. I'll put it, you can put
I'll
it in.
look it up. I got you.
Yes. And then
Okay.
you also have the Trauma Institute. They do certification trainings for therapists, and they cover a whole slew of different modalities that focus on trauma. Then you also have intensive family systems trainings that work well with that. And then you also have hypnosis training that can also work with traumatic experiences. And these organizations are also organizations that do provide a directory of therapists that also do trauma that provide trauma treatment. A lot of places you may be able to get a therapist that is trying to complete their clinical hours, and they will be able to actively practice this, but you'll be getting the treatment that you need as well. Any other questions before we start to practice?
No, that was it, and just folks sharing.
Okay.
Aurora agrees that trauma-specific therapy is clutch, and sometimes medication is also needed.
Mhm.
Obviously each individual is unique, so it's really whatever works for them.
Yes, yes, it is. With the understanding that the symptoms can be treated, and they can not solely be treated with medications, because medications will also treat other symptoms as well. So it's not saying that it does not work. It's just saying that it will also cover it up as well. So it depends on what other symptoms or what other experiences people are having. Anything else? Okay.
No, that's all.
So what I ask you to do is to be as comfortable as possible. If you're sitting down, if you're laying down, note if you're sitting down, you're noticing your feet, you're noticing your extremities as you're slowing down your breath. And as you're slowing down your breath, we're going to start off with the 4 elements, right? The 4 elements is earth, air, water, and fire. So for earth is, right, you're grounding. You're noticing, you're becoming mindful of, hey, I am here now. I can see a lamp, right? I can see the water bottle. I can see the other lamp. I can see this artwork here. You're noticing what you're seeing around the room. It's just what you see. Then you're also noticing what you're hearing. You're noticing the smells. As you're taking some nice breaths. We're grounding ourselves. We're aware of the space we're taking up. You are allowing your chair to fully support you, so you're not supporting yourself. And you are allowing, if you're on your bed, for the bed to do its work, to support your whole body. And now we're going to go into air. I'm going to be breathing, taking some nice long breaths if you're able to. In through your nose and out through your nose. Or you can do whatever favorite exercises you know that calms you down. So we're bringing in your air. Notice that sensation. Now we're bringing in water. And this is one thing you can do anywhere. I want you to create more saliva in your mouth. All right, and as you're creating more saliva in your mouth, now we are activating your digestive system. When our body is in fight or fright, your sympathetic system gets all out of whack, right? So now we're bringing it to, we're trying to shut that down, and we're trying to activate your parasympathetic, which is calming. It allows us to digest. We're trying to allow you to be relaxed as possible, as much as you're able to relax. So you're creating saliva in your mouth. Sometimes it may feel weird to do that, but I ask for you to give yourself permission to do it. And now we're bringing in fire. And fire is we're lighting up your brain, your creativity. So I want you to think of bring an image of something that is beautiful to you, something that makes you feel so good and so great that allows you to feel like, yeah, I can vibe with this. Right? It can be just you sitting listening to music. It can be you being on a hammock. It can be you at the beach looking at the water. You can be in the forest. Notice that sensation. It allows you to feel really good about yourself. Notice how that feels. Continue to take some nice breaths. And as your body is calming down, we're going to do a little simple tapping where you will put your hands like a butterfly and you will tap under your collarbone. Just a few taps. As you're noticing the good sensation. And then you stop and continue to take the nice breaths. As you're looking at the image, you're noticing that nice sensation. If your body gets disrupted because you notice some tensions come up, you're like, okay, I'll allow you, and then you let it go. I would like to know, how is this feeling to you right this moment? Notice, does it feel good? So this is one exercise you can do. Now we're going to go into another exercise. Continue to notice the good feeling you're having. And this is where we begin to identify a calmer space or a safe enough space. And here, we're going to do what we call bilateral stimulation, but we're going to do it with tapping. So I want you to picture, if you want to use the same space, you can use the same place. That gives you the nice, good feeling. And as you're slowing down your breath, I want you to pay attention to the details of this. If you're by the water, you're paying attention to the waves, the sound of the waves, how they look, the foaminess when they hit the shore. If you're in the forest, you're paying attention to the details of the trees, the sound of the leaves, the color of it, the smell of it. If you're by a lake, similar. You're listening to music, you're listening to the cadence of whoever's singing or the sound of the drums or violin. Notice the sensation that it gives you. And as it's giving you that nice calming sensation, I want you to scan your body and notice like, oh, I like this. And if you like it, you're going to tap. And you can hear me tapping, just tap as you are noticing that good feeling. You're taking some nice breaths. As you're noticing the good sensation you are experiencing. Take a nice breath. Notice a sensation. If it is a good sensation, we will tap again. If it is not, sorry, I ask that you go back to the image, pay attention to the details of the image. Notice a nice sensation it gives you, and you can tap again. Notice how your body's responding. Notice how it feels. If you like the way it feels, we're looking at the details. We're noticing the scent of where you are. If it's the beach, the smell of the salt, the forest, the smell of the greenery or the humidity. Notice how it makes your body feel. If it feels good, let's tap again. Take a nice breath. If you're liking the way it feels and you're noticing, I feel very relaxed. I feel like I can fall asleep. Let's do it one more round. Notice that sensation with the image in your mind and start tapping again. Take a nice breath. And now I ask that you give this image that allows you to feel calm enough and safe enough within you a name. It can be the ocean waves. It can just be simply the trees. It can be the sunset. Any name you want to give it. Once you identify the name, I want you to say the name out loud as you have the image and your body still feeling calm. So you say, the beach, I see it, I feel it. Let's tap. Nice breath. Let's go back to the image. The name that you've given it. Notice the sensation it's having in your body. And let's tap again. Take a nice breath. Remember, we are tapping to the good feeling. If a tension or something comes up, we don't tap. We bring in the good feeling and the good image. Notice the sensation that it gives you. We like the sensation. We like how it makes us feel. It allows us to feel comfortable. It allows us to feel calm enough. Say the name of it out loud and tap again. Take a nice breath. And slowly come back. And first, I would like to ask you, do you have any questions? We can do a couple of questions first before we stop our recording. If we don't have any questions, we want to be able to make sure that when you're doing this exercise, you are feeling calm enough or safe enough. You do not do this when you're driving or when you are using any machines or anything like this, right? With the calming of space, this is something that you can utilize since you have the name for it. So if it's the beach, the goal is you will practice this as often as possible. You can practice it in the evening times. You can practice it in the morning time with your tapping, right? And that can allow you for your body to record this as this is a safe space for me. I can actually do this, right? And then it'll get to the point that you say the word and your body will be like, oh yeah, I'm in it, right? So when you're feeling highly stressed or anxious or all these things are happening, you can say the beach and your body will go, huh.
Have a couple of questions.
Okay, the couple of questions.
Can you do exercise to music?
This, no, we don't want to do that. The breathing exercises, the body movement and your yoga and your organized dancing, absolutely, yes. But with this, we don't want to do it.
Okay. Also, um, curiosity regarding the tapping. What does that do?
So we're, meridians, and we have different meridians in our body. And that is just points in our body that responds different. But when we're doing here in our collarbone, that is actually the meridian for stress, right? So it calms us down. It allows our body stress system to. So we're tapping to that.
Thank you. And of course, how can we access the recording? Because folks felt this was awesome and they definitely want to play it again. I know I felt like taking a nap, voice very soothing. So I need that in my life.
Okay, so the goal is to be able to put the recording on YouTube. You will receive an email with where the recording is. Okay. We can take some more questions. I'm just gonna stop the recording now and thank you for allowing yourself and giving yourself permission to do this with me.